Hey, Dr. John Bartemus here, about to work on your fearless leader, Kyle Ruth. He's got a couple issues from the garage games this past Saturday. First we'll look at his left calf and then his left IT band and probably his left hip too, because that's a chronic issue for him. So how can chiropractic help with what he's dealing with? Chiropractic can help by aligning the hips so that he's got proper function all the way down the chain. And then soft tissue wise, we'll make them hurt some to break up those trigger points and get the muscles functioning properly and getting rid of waste so you don't create those trigger points. So we'll start here with this left calf. So he's having some lateral pain in the back here, okay? And then down in there's two muscles in the calf, the gastrocs and the soleus. He's having issues in the gastrocs up high and the soleus down low. So maybe he wants to film himself wincing, but it's a good hurt. It's a good hurt. So point the toe for me and pull back. Ow. Good. So what this will do, point the toe. What this will do will break up that trigger point, and go ahead, and increase his range of motion. Okay? And optimal range of motion is always good for working out, so you can get the full movement. Go ahead. The full movement, full pull from the floor, optimum explosion. Okay? So we'll drop down to the soleus here. Same thing, point that foot. And pull up.
Oh, that one's painful.
Yeah, the soleus is mean. And point again.
It's all those double unders from the garage games.
Yeah. And up. And after receiving this, it's always good, point the foot. It's always good to make sure you hydrate well all the time, but especially after getting some soft tissue work, because you want to flush those metabolites, lactic acid, and all the other things that you're breaking up in there. One more.
Dr. B, how much water would be an ideal amount to try and rehydrate after something like this?
An ideal amount of water is take half your body weight and drink that in ounces. So I'm about 190 pounds, so I shoot for 95 ounces a day. I just drink a gallon, which is 128, because again, I'm not just sitting in a chair all day. I'm working out. When it gets hot, you need even more, so you want to overcompensate some.
Yeah, I actually just started doing that at the garage games. I started drinking about a gallon of water a day. So I was having a lot of cramping issues.
Yeah, it'll help with the cramping. It helps with the with your endurance. It helps with your energy levels. And you'll have less trigger points, muscle pulls, things of that nature. It'll help with digestion too. So now we'll move to the IT band, which is giving them lateral knee pain. So here we go. Straighten that leg out. So a lot of runners have IT band pain, and that's going to affect you all the way down the outside of the thigh. It can manifest as knee pain. It can manifest as lateral thigh pain or hip pain, because the muscle starts in the hip and goes down to the knee and connects. So most of the time, knee pain is secondary to a hip or a foot problem. In Kyle's case, it's a hip. Okay. And I don't know if he's told the gym, but he's added 100 pounds to his deadlift in a short amount of time, which is awesome. And so that's going to affect the hip all the way down the chain. So here is the TFL, which is the muscle belly of the IT band. And he'll tell you this is probably his least favorite one.
Oh, this one hurts.
Back up.
I can feel this when I squat, this same muscle right here.
Yep. So when you squat, when you're at the bottom of the squat, you probably feel a little catch when you go below parallel.
Oh, yeah.
Is that when you feel it? So this is working that trigger point out so he can hit the bottom and explode up. And one more.
So, Dr. B, how often would you recommend that someone get a treatment like this, like ART? I know I've been doing once a week, but what's the ideal?
Ideal would, for you, definitely once a week with the level you're training. Preston trains, level I train. I get it twice a week usually. If it's just someone coming to work out in the gym on a non-competitive level, then we'd go by kind of how they're responding functionally.
Right.
Probably weekly initially, and then as they're holding, we push them out. So
excellent.
It's an individual thing.
Well, Dr. B, thank you very much.
You're welcome. Thanks for having me. Look forward to meeting you all.